Good morning. Again, welcome to this series of Decoding Obesity, the outcomes of the treatments and the impacts of the disease. This is how you will see that these people will carry some kind of swelling on the legs. Swelling on the legs indicates of fluid retention, which means either the heart or the kidney is unable to perform well, and this is why the preload on the system is very on the rise. This obviously leads to shortness of the breath, fatigability which is very high on small exertions. On the top of it, this also leads to a heart attack like situation where the heart fails to supply the good amount of oxygen to itself. Again, the heart vessels can get laden with that cholesterol plaques, and that is where we call it as the heart attack or the ischemic problem of the heart. So in all, heart doesn't like your extra weight. Please remember. Number 2, the lungs. Lungs again are supposed to give a fantastic ventilation, and the ventilation through perfusion to the body. When your body starts putting on weight, there are sites which are otherwise should not be carrying the heavy fats start also getting laden with the fats. Typically, when your tummy is growing, remember it doesn't grow in only one direction, it grows in all directions because it's a rounded cavity inside, and this is where the lung capacitance goes down. When the tummy is growing big, typically, it compresses your lungs in the upward direction where the lung capacitance goes down and the expansion ability of the lung goes down, which leads to again shortness of the breath. The lungs start performing in a very awkward situation, in a burdened situation, and typically lungs will give rise to shortness of breath in addition to your heart troubles as we discussed in the beginning. This is called as the asthma of the obese, which doesn't mean that the lung is primarily the asthmatic lung. The lung is now facing the troubles because of the obesity. This is called as obesity hypoventilation syndrome. So when we talk about obesity hypoventilation syndrome, the patient will have again the easy tiredness. They have to really struggle to get oxygen and support the whole body. The demand of the body of the oxygen is on the high. These people who are having the central obesity will also have a big neck, which is again indicative of compression on the breathing pipe in the neck. This also leads to shortness of the breath. So this is called as the obesity hypoventilation syndrome, where the lungs are suffering because of the non-expansile capacity which is utilized to a good extent. The other part which is as good or as important as this is the complete breathing apparatus of an individual. When this gets affected with obesity, we call it as OSA, that is obstructive sleep apnea. A person with a big tummy, a person with a shortness of breath, a person with a big neck will obviously have shortness of breath predominant when you are lying down. So during sleep, these people will snore a lot. Obviously, the snoring person himself doesn't know that he's snoring, but the others in the room can tell you about it. This snoring indicates that there is an obstruction in the complete breathing system of the patient, and this can be very life-threatening. Obstructive sleep apnea has many components and many stages.